It has been so much easier than I thought it was going to be to have braces. Cosmetically and just living day-to-day life with having them on, it's not a big deal.
You just heard from one of the many satisfied patients of Fast Dental in Fresno. And just like Ryan, if you need braces but just don't want to deal with the long process, you should definitely visit the experts at Fast Dental. Here now to tell us more about what they have to offer is Dr. Thomas Week and son Dr. Timothy Week and two of his patients, Alexis and Zoe McComb. Welcome all of you. How are you?
Hi. Nice to be here.
Nice seeing you again, doctors. How are you guys? Okay, first of all, we need to tell our viewers about the services that you guys have.
Well, our primary focus is to offer a new product that's available in dentistry called Fast Braces, and it allows you to get your teeth straight in about 120 to 180 days instead of the traditional 2 years.
Fast braces. So we're talking about what, like 6 months, right? Around
6 months,
there?
just about.
And the traditional is what, 2 years?
2
so
years.
People need to understand that it's super fast. And it's affordable too.
It's affordable because if it's half the time, it's half the price.
Exactly, exactly. But of course, who are the patients that are qualified to get that type of braces?
Well, you need to come in for a consultation. Not everybody's a candidate for fast braces, but about 80% of the population can have fast braces. And so you come in and we can look at your teeth and let you know.
And let's talk to the
adults and adolescents.
Exactly. People need to remember that if you're an adult, you can still get this.
Basically age 12.
Really? From starting at age 12 and above.
12 to 80.
Okay, keep that in mind, people.
12 to 80.
And 80, of course, that too.
Yeah, the upper limit.
Yeah. And then the twins. Okay, ladies, you need to tell us a little bit about your experience.
So I got mine on at the end of the July, and my goal was to have them off before Christmas, which it was kind of like, I didn't think it was possible. And then I got them off before Christmas, and it was crazy because I really didn't think it was going to happen, especially for the price. I was like, that's insane. And then
I'm going to be able to get mine off before my birthday next week, so I'm really excited about that.
That is great. Okay, and we're looking at before and after pictures here. Okay, doctor, please tell me a little bit about that.
So this is Zoe. And she just, she had some arch discrepancies where her bite was tilted, and then you can see how they're straightened at the end. So it really helps to get your smile right so you can feel more confident. You can see how the arch form is a lot better and more even.
Okay, and this is Zoe, right? And Zoe, don't be ashamed. You
Those...
have beautiful teeth now. Look at your smile.
Thank you.
And Alexis, you're almost getting them off, right? I think we have images of Alexis as well. Could we see those?
Right, so Alexis had a very deep bite in the front. You see how you can't see her lower teeth.
Yeah.
And so now you can see when she's in her braces, that was the before as well. So when she's in her braces, you can see how we've leveled her teeth out. And the unique thing about fast braces is the bracket design and the wire design was developed by a Dr. Tony Biazzi out of Dallas, Texas. And he made it so he studied the way teeth grew in. So normally a tooth comes in about 6 months, and so he developed the bracket design and the wire flexibility to encourage the teeth to move in that period of time.
Wow, that's why they have. It's such a fast process. That's the reason,
that's right?
And of course, Dr. Timothy, we're gonna ask you a question.
I'm here.
Okay, you guys are a one-stop shop. You know, that's not all the services you guys offer, right? You guys have something else going on too.
Yeah, I mean, we're the key to our practice is that we are a general dentistry practice. First of all, we're not orthodontists, so we have the ability to function as kind of a one-stop shop for patients, especially patients who don't have a general dentist. Currently, we don't necessarily have to send you out to get other work done. A lot of times orthodontists see patients and there's decay, there's other forms of disease, and they say, well, there you go, you know, got to send you to a general dentist first, and then, you know, and then you come back and get your braces on. So there's a bit of kind of shuffling around within the dentist and specialist community there, but in our office you can basically get it all done under one roof, and some stuff you need done afterwards, we can take care of that too, crowns, implants, that sort of stuff. Now it's important to recognize, I think, that we would love to have the referrals of general dentists to our practice, and that's something I didn't really talk to you about last time, but
Yeah, let's mention it, yeah.
you know, there's a professional courtesy thing there that, you know, as a general dentist, if I were, you know, sending somebody to an orthodontist, I know how that relationship works. And I just want everybody out there to know that we do that relationship too. If you're a general dentist and you send us a patient to get ortho done fast, we're going to give you that same professional courtesy. If there's any general dentistry work that your patient needs, we're going to let you do that. We'll take care of the ortho.
Well, that's
instead of-
something that it's nice that you mentioned that, so we could have that in mind as well.
Yeah.
Alexis, I'm gonna go back to you. I know that you're not done with your process, but so far, tell me a little bit how has it been?
It's been crazy. So my bite came in, I think it was 75%. And my teeth had never kind of clamped together correctly. And so now that I'm almost done, I just feel the difference inside my mouth. I mean, you might not be able to see the little changes in the back, but just feeling and even eating, and I'm gonna get them off probably next week. So they're almost done.
And I'm pretty sure you can't wait to just bite properly.
I know, I
right?
can't
With
wait
the
to eat.
braces. Yeah.
And it's only been a few months for me, so I'm very fortunate.
And you told me earlier that you didn't even know they were supposed to go like
I had no idea. My teeth in the back used to be so far slanted in that they would not connect properly. So they were kind of hitting like this instead of the correct way that they're supposed to.
So you've had him like that forever. So in your head, you're like, this is normal.
yeah,
this
I
is all
didn't think
good,
anything
right?
of it. So I'm very grateful to the doctors and their technology, and especially the price. The price is amazing, and I think they create such a personal relationship with them that you can go and he asks you, you know, do you want this specific tooth shaved down or do you want it left the way it is? And I think as somebody who really appreciates that personal connection, and you know, he's very focused on your mouth and your teeth at that time, and you don't think that he's just kind of cattling you in like every other orthodontist that I've kind of talked to in the process.
That's amazing. That connection is really important, doctor. And you know, like we're hearing it here. They give you guys that connection if you go with them. And doctor, if people are interested in an appointment, how does that work?
Well, they just call our office and they can schedule an appointment, or you can go online to our website and you can schedule online, and we can see you pretty much any day you'd like to come in.
Perfect.
Yeah.
Great. You guys, thank you so much for being here and giving us that information.
Yes,
An important